how big a deal is this AI thing? It's been, unless you've been under a rock, you've probably noticed AI kind of seeping into your life in many ways. And in our industry, it is happening a lot faster than even I anticipated. But what we know is that that AI is likely to be as big a change for us as the Industrial Revolution or the internet itself. I've heard even bigger estimates than that. But we always get into this topic of unemployment and will it take my job? It's unlikely that our industry is going to be affected by this because there are just several reasons why AI is not going to take your job. One, well, three and a half reasons exactly. But all of what we see in AI in healthcare right now is really augmented intelligence, which means it assesses clinicians in making decisions. It does not make decisions for clinicians. So it's a tool to help you do your job better, very much like collaborative documentation is in terms of help. It's a tool to help you do your job a little bit easier or faster. So it's not a replacement for clinicians' judgment. Secondly, we just talked about this. We're looking at 500,000 unfilled jobs in the behavioral health market. And third, the AI algorithms that are out there are really good at defining stable and define stable environments like playing chess, but they're not particularly good at navigating what I would call ill-defined or complex environments, and that's really where you guys live. And finally, 3.5 is that artificial intelligence is not the same as artificial humanity. There are things that only you can do and only things that add value to that clinical transaction that AI cannot do.